All right, now that we've seen how the spinal nerve arises from spinal roots and gives off spinal rami, we're going to follow those rami, especially the anterior rami, as they form structures that innervate the muscles of the body. We're going to give off a cervical plexus for the neck, and here from about the C5 to T1 levels of the cord, we're going to give off the brachial plexus of the upper limb. And in the lumbar and sacral regions, we'll give off nerves that innervate the muscles of the trunk of the body, as well as the muscles of the lower limb. The muscles of the trunk and limbs are innervated by anterior rami coming from the spinal nerves at each level. However, these will often form plexi, or singular plexus. We'll start with the cervical plexus, which is going to be involving the anterior rami from C1 to C5. So we'll just draw, or rather write in those levels that are involved in contributing there. And their anterior rami are going to do a variety of things. C1 is going to travel to the suprahyoid and infrahyoid muscles, but to do so, it's actually going to make a loop down here along with C2. And that's how these are going to reach the infrahyoid muscles. So we have a couple suprahyoid muscles here, infrahyoid muscles here, and we also have contributions from C2 and C3 going to those infrahyoid muscles. And as these come down, they sit in front of the carotid sheath of the neck, and they actually make a loop. So as they make that loop, called the ansa cervicalis, they're going to give off branches to those muscles that are going to be in the infrahyoid region. Apart from that, C3, C4, and C5 all contribute to the phrenic nerve. So let's just draw in here. We have our ansa cervicalis and our phrenic nerve, which innervates the diaphragm on each side. So very important nerve, comes from way up high, C3, 4, and 5, keep the diaphragm alive. Then we have some other branches coming from C2, C3, and C4. And these are fairly complicated, and we're not going to worry about those right now. However, they are going to contribute multiple cutaneous nerves that are going to innervate the posterior scalp, the area of the ear, the auricle of the ear, the outside, as well as the neck. So we have sensory nerves going off of these levels too from the cervical plexus, motor to the infrahyoid muscles, and motor to the diaphragm. Moving a little further inferiorly, we come to the plexus that innervates the upper limb muscles. This is the brachial plexus. And the brachial plexus is getting its anterior rami from the C5, C6, C7, C8, and T1 spinal nerves. So we have each of those anterior rami stretching out this way, and these are the anterior rami of each level, but they are also called the roots of the brachial plexus. And don't confuse these with the spinal roots we talked about just a few minutes ago. I know it's irritating. I don't like it either, but these are sometimes called roots. Now, the brachial plexus has a great deal of mixing and mingling of axons as it goes from one part of the body to the other, and this mixing is a source of consternation for medical and other health professional students since time immemorial. We're not going to worry about the details of it. I just want you to know that there is a lot of transitioning going on here, but the final product is going to be 5 terminal nerves that are going to come out of this. And these nerves are all named, and most superior one here, coming mostly from the C5 and C6 roots of the plexus, this is going to be the musculocutaneous nerve. And it innervates muscles of the anterior arm. So flexors of the elbow, like the brachialis and the biceps brachii, are innervated by the musculocutaneous nerve. We'll jump down here just a bit to this guy. This is the median nerve, and the median nerve is getting innervation from almost every one of these levels. So the median nerve is going to innervate the muscles of the anterior forearm and some muscles in the hand. Now, next up here we have the counterpoint to the median nerve, and this is the ulnar nerve. And it's largely getting its input from the C8 and T1 levels, and it is going to innervate muscles of the anterior forearm as well, and the hand. And seems like it's doing the same job as the median nerve. One way to keep track of these is that the median nerve innervates a lot of muscles in the anterior forearm and just a few in the hand, whereas the ulnar nerve only innervates 2 muscles in the anterior forearm but many muscles in the hand. Now we're going to return back up here to these roots that are coming off a little more posteriorly. Can't see the 3D here, but they are coming off more posteriorly. This is the radial nerve, and it's also getting input from pretty much the whole plexus, almost all the plexus, and it's going to innervate the extensors of the arm, triceps muscles, forearm, all those extensors in the posterior compartment of the forearm, and any extensor of the hand will also be innervated by the radial nerve. So that has a pretty big job. And last but not least, we have our axillary nerve. And it is only innervating 2 muscles. It's innervating the deltoid muscle as well as the teres minor. And those are going to be involved in rotator cuff activity, so we're just going to say muscles of the shoulder. Now, I want you to note there are many muscles that aren't accounted for just by the big 5 here. They get innervation from other parts of the brachial plexus, but we're not going to sweat those for right now. That will be something for another video at another time. As we move a little further inferiorly to the thoracic level, we have 12 thoracic spinal nerves. So we're going to draw those in, and each one of those is going to split into an anterior ramus and a posterior ramus. And it's easiest to see the dermatomes associated with the spinal levels in this area because, good news, these thoracic anterior rami do not form plexi. They just remain as individual intercostal nerves, or in the case of T12, we call it the subcostal nerve because it's below the last rib and not between any ribs. So, the good news here, no plexi to worry about in the thoracic region. Moving on though, the good luck can't last forever. We're going to come to our lumbar plexus. So our lumbar plexus is going to be involving L1 through L5. Now I'm going to draw T12 in here just for reference, but again that's the subcostal nerve, it's not contributing here. But then we have L1, L2, L3, L4, and L5, all contributing anterior rami to this lumbar plexus. Now L1 is actually pretty simple. It continues on its own and just later splits into 2 named nerves. This is going to be the ilio-hypogastric and ilioinguinal nerves, and they are going to be innervating some of the abdominal wall muscles as well as the overlying skin. Now, L1 and L2 both have a branch that comes together here to form what's known as the genitofemoral nerve. And it's going to be sensory and some motor to the area of the anterior thigh and genitalia, just on the anterior side there. And then, coming from L2 and L3, we have the lateral cutaneous nerve of the thigh. And its name is basically telling you exactly what it does. It is going to be cutaneous to the lateral upper thigh, comes from L2 and L3 right there. And now we get to the major players, the ones that are probably most important. L2, L3, and L4 all contribute to the femoral nerve. And the femoral nerve innervates all the muscles of the anterior compartment of the thigh, so the quadriceps muscles, the sartorius muscles, the muscles that extend the knee strongly, are all getting their innervation from L2, 3, 4, and the femoral nerve. Funny enough, L2, L3, and L4 also create the obturator nerve, which is going to innervate the muscles in the medial compartment of the thigh. Now you may have noticed I'm only talking about muscles. I'm not going to go over the sensory distribution of these nerves in the upper limb or the lower limb, but those are there also, and they can be important a little bit later as you learn. Now we've covered femoral and the obturator. Last we have L4 and L5 fusing together. They don't actually innervate anything in the lumbar abdominal region. Instead, they're going to descend into the pelvis, and this is known as the lumbo-sacral trunk, because it's going to be a trunk from L4 and L5, but it's moving into the sacrum to interact with the nerves of the sacral plexus. Alright, so let's talk about the sacral plexus, sometimes called the lumbosacral plexus, but here, sacral plexus, we have inputs coming from L4 and L5 up in the lumbar region. Those two come together to form what we're calling the lumbosacral trunk. And then, no big surprise, we have S1, S2, 3, 4, and 5 in this area. So the anterior rami from the sacral levels will contribute to this sacral plexus. No big surprise there. And we'll just add one coccygeal there as well. Even though it's not going to be doing a whole lot, we'll add it for the sake of completeness. Now, L4, 5, S1, S2, S3, S4 are going to contribute to one of our major nerves of the lower limb, and that is the common fibular nerve. So we're going to draw branches of S1, 2, 3, and 4 joining with the lumbosacral trunk to create the common fibular nerve. So that's what's happening right there. One thing I want you to note is that the common fibular nerve further down around the knee is going to split into a superficial and then a deep fibular nerve. And these are going to innervate the lateral compartment of the leg and the anterior compartment of the leg, respectively. They do a few other things, but those are some of the major functions. Now, returning up here to our sacral plexus, L4 and L5 are going to contribute to yet another great big nerve. And this one gets contributions from S1, S2, and S3. This nerve is the tibial nerve. Now the tibial nerve right here is going to be traveling all the way down the leg, and when it gets to the foot, it's going to split into the medial and lateral plantar nerves. They're going to supply the muscles of the foot, whereas the tibial nerve itself is going to supply all the muscles in the posterior compartment of the leg. Now, one thing before we go any further is to note that the common fibular and tibial nerve travel together. They actually are bundled together in the thigh, and their name is, as a combined unit, is called the sciatic nerve. So if you've heard of the sciatic nerve, it's literally the bundling of the common fibular and tibial together, and they don't fully separate physically until we get down to the popliteal fossa on the posterior side of the knee. Alright, let's come back up just a little bit more. We've got two other nerves proximally here to take a look at on this side. L4, L5, and S1 contribute to the superior gluteal nerve, and that is going to innervate the gluteus medius and minimus, as well as the tensor fasciae latae, another muscle in that region. And then L5, getting a little crowded here, my apologies, S1 and S2 contribute to the inferior gluteal nerve, and that has one job, and that is to innervate the gluteus maximus, strong extensor of the thigh at the hip. We're now going to travel way down into our pelvic area. S2, 3, and 4 are all going to come together to form the pudendal. I cannot write sideways, my apologies. The pudendal nerve, and the pudendal nerve is going to innervate the muscles and skin of the anal region and the external genitalia. Now, the levator ani is nearby, but it tends to be innervated by a separate nerve coming from S3 and S4. So that's going to be the nerve to levator ani. And S5 and the first coccygeal, they're really not doing a whole lot, but they do tend to fuse together to create what is known as the anococcygeal nerve, which is going to be a little bit of motor and sensory to the external anal sphincter and the area around there. I only included it here for the sake of completeness because it's very tiny, and we just wanted to make sure that we knew that S5 and the coccygeal nerves were in fact doing something. Now that we've seen that schematic version of the brachial plexus, let's return to this model and see some of the nerves that are represented on it. One thing I want you to note, though, is that all models are wrong. Some models are useful, but no single model can encapsulate everything that the world has to offer. So no matter what field you're in, models are useful, but you can't rely on them 100%. And pursuant to that is we can't really see the musculocutaneous nerve going into the anterior compartment of the arm here. So we'll remove the deltoid a bit, as well as the biceps brachii, and we'd expect to see the musculocutaneous nerve traveling in this area, innervating the muscles of the anterior arm. But fortunately for us, we can see the median nerve represented here, traveling down the midline of the arm and forearm. And as we pass into the forearm, we can see the median nerve here. It's going to travel all the way down into the palm of the hand. It passes through the carpal tunnel and is the nerve affected by carpal tunnel syndrome down here. So we have our median nerve there. It is giving off multiple muscular branches here in the forearm and hand as it innervates those muscles, and including one here called the anterior interosseous nerve. Don't sweat that one for right now, but it does exist. It's a branch that innervates some of these deep muscles. And the median nerve is going to have some cutaneous sensation on the palmar side of the hand, especially digits 1, 2, 3, and half of 4. Here, returning back, we can see our ulnar nerve. Now the ulnar nerve does something a little bit special. It's going to travel posterior to the medial epicondyle of the humerus, and it's actually vulnerable to damage there. But then it's going to come out in this anterior compartment, innervate two of the muscles in the anterior compartment of the forearm before traveling into the hand, where it innervates many of the intrinsic hand muscles and provides cutaneous sensation for this half of the fourth and all of the fifth digit, and that's going to happen on both the palmar and dorsal sides. Now I'm just going to reflect this here, but I don't think there's any other nerve stuff for us to see other than some branching of that deep branch of the ulnar nerve, whereas its superficial branch is going to be carrying sensation out to the hand there. Returning, we've covered the musculocutaneous and median and ulnar nerves. I should mention the musculocutaneous nerve is sensory to the lateral forearm, but we're now going to look at the branching of the radial nerve. And the radial nerve is huge, but we can't really see it branching here in this model, but it's going to dive into the posterior compartment of the arm to innervate the triceps brachii muscles. We can see some cutaneous branches popping out here, but then right here we have a nice big radial nerve traveling out to get to the extensor muscles in this posterior portion of the forearm, of the forearm. We have a posterior interosseous nerve, which is a branch of the radial, innervating these deep muscles here. And the radial nerve will be sensory to the skin over the posterior arm, posterior forearm, and the dorsum of the hand, with the exception of the fifth and part of the fourth digit. Returning to this model, we're just going to very quickly look at the not a plexus formed by the intercostal nerves from T1 down to T11. These are going to individually come out as anterior rami and stay individual nerves as they travel through the intercostal space. The only exception being the one located below the 12th rib, which is the subcostal nerve, which has no other rib to be between. If we look a little further down, we can actually see the Lumbo-Sacral Plexus coming into shape, and we'll review it in conjunction with the lower limb. We can now see the pelvis, and we're going to explore the lower limb as well. Now here, we're starting kind of in the reverse direction that we're used to, but we can see the sacral plexus here, going to be giving off the sciatic nerve, which as we know is a combination of the tibial and common fibular nerves. We have the lumbosacral trunk here coming from L4 and L5, and just here I want you to note our obturator nerve, and as we reflect a little more anteriorly, coming from L2, L3, and L4, we have our massive femoral nerve. And the femoral nerve is going to pass through this inguinal ligament and we'll move into the anterior compartment of the thigh. So let's remove some of these muscles, and we can actually see the branching of that nerve as it's going to innervate all the muscles of the anterior thigh, the quadriceps muscles, the sartorius. Now here, we saw the obturator exiting the obturator foramen. It's going to come down and innervate the muscles of the medial compartment of the thigh. So the gracilis, the adductor longus muscle, and the adductor magnus muscle. So we can't see the nerve here, but it would be present, providing motor to these muscles, as well as a bit of skin on the medial thigh. Returning here real quick, running alongside, we have a continuation of the femoral nerve, but this portion of it here is called the saphenous nerve. And the femoral nerve is sensory to the anterior thigh, has branches going out to the skin there, but the saphenous nerve actually continues down and is cutaneous to the medial knee, medial leg, all the way down almost to the medial ankle. So that saphenous nerve, or saphenous branch of the femoral, is an important cutaneous nerve. Now here, let's reflect over to this side now. We're going to take the gluteus maximus off, and here on this side we can now see some of our big nerves exiting. We have our sciatic nerve, the combination of tibial and common fibular, leaving right here. This muscle, one of our lateral rotators, is called the piriformis muscle, and it's a nice landmark. We didn't discuss it in detail, but it's a good landmark because inferior to it is the inferior gluteal nerve, which innervates the gluteus maximus, and superior to it is the superior gluteal nerve, which innervates the gluteus medius, minimus, as well as the tensor fasciae lata, a muscle on this anterior side. But that's it for the hip. We're going to move down and follow our sciatic nerve as it goes a little further into the posterior thigh. We'll remove our hamstring muscles, semitendinosus and membranosus, biceps femoris long head, and we can see that the sciatic nerve continues for a considerable distance in the posterior thigh. These muscles are innervated by it. The long muscles in the hamstring group are innervated by the tibial branch, and the short head right here of the biceps femoris is innervated by that little twig coming off the common fibular nerve. So that's what's happening there. We're now going to follow that sciatic nerve into the popliteal fossa and see what it's doing down here in the leg. So first we're going to look at our posterior compartment of the leg, moving towards the foot. And one thing to note is that all the muscles in the posterior compartment, the gastrocnemius, the soleus, as well as the big three deeper in, tibialis posterior, flexor digitorum longus, flexor hallucis longus, they are all innervated by the tibial nerve, which continues down across the medial malleolus into the sole of the foot, where the tibial nerve will divide to become the medial and lateral plantar nerves, and they're going to innervate the muscles of the plantar foot as well as the overlying skin. Now I hope you remembered what I said about models being useful but not always accurate. What we should be seeing right here is a great big nerve exiting and going around the head of the fibula. The common fibular nerve leaves and goes this way, so it should be laying just about here. and it's going to travel into the lateral compartment of the leg, the fibularis muscles, and that's going to be the superficial fibular nerve. So common fibular gives off the superficial fibular nerve, and in the anterior compartment we are seeing the deep fibular nerve. Doesn't seem to be coming from anything, but they did show it in this part of the model here. Deep fibular nerve innervating the anterior muscles like the tibialis anterior, extensor digitorum longus, extensor hallucis longus, so dorsiflexion and extending the toes involved here. And that nerve continues down onto the foot and is going to be traveling to innervate some of the skin in this area, although the superficial fibular nerve, not represented here, will be innervating the skin on a larger portion of the foot, as well as those extensor muscles just here.